A total hip replacement is a common surgery usually performed because of arthritis of the hip or due to a fall in which you break your upper leg bone or your hip bone. Now there's two approaches to the total hip replacement. First one is a posterior lateral approach, which you'll have a scar towards the back of your hip. With this, there are precautions following the surgery. You should not flex your hip over 90 degrees. So right now I am sitting in about 90 degrees. You want to avoid flexing the hip above 90. You want to avoid adduction, which is taking the leg and crossing midline. You want to avoid internal rotation, which would be turning the foot out and the knee in. And you want to avoid crossing your legs at the ankle or any of these motions in a combined fashion. A lot of times when you're first out of surgery and you're starting physical therapy, doctor might want you to avoid any type of side-lying abduction, abduction. So if the surgery was on my left side and I'm lying on my right, I'll probably have to hold off for about 4 weeks on doing sideline abduction. And also for the first 4 weeks, there should not be any type of resistance applied to the surgical leg, so no resistive range of motion. When you do lie down in bed, the doctor may recommend a pad or a pillow to go between your legs to avoid any of those precautionary positions, such as bringing your legs together. So there'll be a pillow between your knees when you're lying on your back. Your focus will be to keep your kneecaps pointing up to the ceiling. When you do go to sleep at night, if you have to sleep on your side, some doctors will recommend sleeping on the surgical side. Some doctors tell you not to sleep on the surgical side. If you sleep on the surgical side, so if it's my right side now, and I lay on my right side, my hip is pretty much in that neutral position, so it's safe according to the precautions. But if my surgical side is my left hip and I sleep on my right side, there's always going to be that risk of the surgical leg dropping past midline into that adduction and internal rotation, which immediately following surgery, for the first usually 3 months, that's something you want to prevent. You don't want to do that movement. So you can ask your doctor, but I would recommend if you're going to sleep on your side, sleep on the operative side or the surgical side. Now your anterior hip approach, you're going to have a scar in the front this time. These precautions, there's one similar motion. You shouldn't be crossing your legs after surgery, but instead of avoiding flexion and internal rotation, you want to avoid extension, which is this motion, or external rotation, which is turning the ankle in and the knee out. So for the posterolateral approach, avoid flexion past 90, adduction, internal rotation, or any combination of those, as well as crossing your legs. For the anterior approach, you want to avoid extension of the hip, external rotation of the hip, and crossing of the ankles. Your doctor will tell you how long to maintain these precautions. An average is usually about 3 months. Now post-surgery, when you get home, you're going to probably be put on blood thinners. So you will have a visiting nurse come to the house to take your blood work, your PT-INR, to see how your blood is clotting. They don't want it to be too thin, but they don't want it to be too thick. And that is due to you want to avoid any type of DVT or embolism developing in the leg following the surgery. You'll have home care probably for 2 to 4 weeks, and then you'll have outpatient physical therapy probably for another 6 weeks. Now, you're going to have a bandaged wound, which the dressing will most likely be changed daily by the nurse. You want to watch for any type of redness, any type of fever, any abnormal drainage. Just keep an eye on that because the nurse will come to change the dressing, but for the rest of the time, you're responsible to keep your eye on the wound. You'll also be given what's called TED stockings, which are those white tight stockings that either come up to your knee or come up to the top of your thigh. And those are also used for prevention of any type of DVT or embolism. Now you can remove these stockings overnight and twice a day for 1 hour each time. Most of the times you'll be wearing these stockings for about 6 weeks. You will also be provided with a incentive spirometer, which is the tool, the plastic with the ball that rises up when you inhale and exhale into the unit, and that's just to help your lungs to recover after the anesthesia. You want to keep your eye on your heels, because a lot of times you will not be as active as you used to be before the surgery, so you may be in bed a lot. Your heels may soften up. There might be some skin breakdown because of the constant pressure of your heel on your mattress. So if you're going to stay in bed, you want to roll up some towels, put them under your ankles to keep the pressure, the direct pressure off of your heels. You can plan on seeing your surgeon 10 days post-op. Many times he'll take the staples out if staples were used at the incision site. You'll see him 3 to 4 months post-op, 6 months post-op, and 1 year post-op, as well as any time after that.